Well, hello and welcome. Dr. Seal here, Junior Doctor from Australia on the Psychiatry Training Program. And in today's episode, we are going to be reviewing some old school footage titled Acute Schizophrenic Episode. Now, I know my desk is an absolute mess. My whole room is an absolute mess, and I do intend to clean today, but the show must go on. So I wanted to get a video done. So let's just do it. You can spend all day cleaning, but if you don't get to work, then what's the point? So let's react to this footage. We're going to talk a bit about psychosis, about schizophrenia. We might talk about the positive symptoms, the negative symptoms, the treatments, the challenges. I've worked a lot in managing schizophrenia, both in inpatient settings like high security units, forensic units, and also in lower dependency units. And I've also worked in a community team, managing it in the community. So I've seen a lot of different severities, different types, different treatment resistances in schizophrenia. And it's a fascinating illness. It can be very debilitating. It can be catastrophic, and so it's important to have awareness about it, but there is a lot of hope for people to get recovery, have meaningful lives. And so that's why I do what I do. That's why I work in psychiatry. If it's your first time here and you're enjoying the content, consider leaving the video a like and subscribing to the channel. I make heaps of videos like this, but other than that, let's get into it.
Sort of symptoms did you have that made you feel, or people around you feel, that you should be in hospital?
I didn't realize I had any symptoms. I don't think anybody else did until Sunday afternoon. And it just something happened to me. I don't really know what it was. Just seemed kind of like something snapped inside of me. And that what those... I couldn't hear. I could hear the people around me talking. Yeah, but it didn't, it didn't make sense. I couldn't really understand all. And then when I was in the hospital, they got me in the hospital, gave me a shot, and I slept out Sunday night. And Monday morning when I woke up, I was hearing voices. Seemed like they were right back here. I could hear them.
Already there's a lot to unpack there. I guess the interesting thing is she didn't really know anything was wrong, and then something just kind of snapped, and we haven't really gone into the details of what happened to lead her into hospital. But whenever someone kind of says I like that things just started to go wrong, I didn't really know there was anything wrong. I don't really know what was happening. I sense that can be called a delusional mood. Like it's the start of kind of delusions forming. There's no real evidence, but something's going on. Then she gets sent to hospital and gets given a shot, which can be pretty common. We always offer oral medications, but if someone has come in with acute psychosis, you do need treatment, especially if it's black and white and really obvious. So it's either oral medications, but if they refuse, then they will get an injection, especially if there's risks. If someone's low risk and psychotic, you talk to the consultant, it's a bit more tricky. But if someone's high risk, they definitely will get medicine because they have the right to get better. I'm also just noting she's kind of sitting in this kind of interesting position where she's kind of closed off-ish, kind of retreating within herself. So she might still be feeling a bit anxious or stressed. Now, back in these days, I don't exactly know what year it is, but this might be 60s or something. I know the footage quality is very poor, but hopefully with some post we can make the audio good quality with some post editing. And she said she got given a shot. Now, back in those days, they didn't have many options for medicines, and I think really the most common medicine was chlorpromazine, and then other than that they would do ECT. So it'd be interesting to hear more.
No, I mean, they were talking nice. They were all fussing and arguing hard and just screaming so loud. Shit. It's too much.
So that's she's now talked about hearing voices, auditory hallucinations. People used to split voices into two categories, kind of auditory hallucinations and then auditory pseudo hallucinations. So it's voice, and there's two ways to distinguishing them, but mainly it's, do you have insight into the fact that these aren't real, or do you think they are real? We don't use the term pseudo hallucination anymore, and it's essentially, if you're hearing voices, you're having auditory hallucinations with either preserved or not preserved insight. The content of how they're talking, what they're saying is super important. Voices that are telling you to kill yourself, that are telling you to kill others, that are controlling and inhabiting your body and controlling your movements, which is called passivity phenomenon, those are really high risk, dangerous voices. You have to ask and clarify those things. Voices that are maybe you just hear them when you're falling asleep, or that, there's also commentary voices that just kind of comment on what you're doing. Oh, he's picking up the mouse. Oh, he's having a drink of water. They commentating. That's quite that is a symptom of psychosis, but it's a little bit less risky, generally speaking. Now, hearing voices, having delusions, these are kind of considered the positive symptoms of schizophrenia. Schizophrenia often, most common onset is in the kind of teenage and 20s years. So I can't really see, but she seems pretty young, maybe 20s, I'm not sure. There is very interesting set of psychotic symptoms like delusional disorder and paraphrenia, or adult onset schizophrenia, that happens later in life. And I've seen a couple of those for some reason in the last month, but it's much more common for it to occur in these years. And whether you like it or not, the treatment of psychosis is medications or ECT. There are no talking therapy or like purely psychological therapies to get out of psychosis. You must treat it with medicine. And then once it's treated with medicine, you can engage in the very important kind of psychology, psychotherapy, rehabilitation, occupational therapy, physical therapy, all that really good stuff. But you need medicine to get out of psychosis.
You'd had this experience of hearing any voices?
First time I heard the voices, and then next morning I heard them, and they just it was menstruating, and then I woke up again to give me a shot, and then I was getting a job called on Monday, and then I woke up Tuesday morning, and I heard them again, and then they gave me another shot. And I was struck all day, and I didn't know anything. And Wednesday went and woke up, and I still heard them. And then they gave me another shot, and that's what I came here.
So that's a sad truth of kind of injectable antipsychotics, that they do make people really drowsy. I really hope one day we have a medicine that doesn't make people so drowsy and feeling, as she says, drunk. I think they are a bit better these days compared to maybe what she was getting back then, but still people feel really sedated. There's lots of kind of side effects that antipsychotics can have. Some of them can have stiffness side effects called EPSEs, where people can have muscle contractions. These are treatable. You need to tell your doctors, and they are treatable. There's other side effects like inner restlessness, akathisia, agitation, kind of activation, agitation, inner restlessness where you can't really sit still, you need to walk. And then there's tardive dyskinesia and Parkinsonism as well, which are less common in the early kind of days.
How are you feeling now?
Right, and then he took this, and then just hold it down.
You hearing the voices?
Not too much. I keep trying to push them away because I don't want to hear them.
Is there anything in particular that you can detect?
I don't know. Every now and then I can hear my daddy. He's hollering and fussing at my mom because she spends too much money. Down there, not a why this doesn't do right about my little brothers, and she's a poor manager, and that she can't give it on the money that he gives her around the house. I think Mama always out and says it. Tommy's not me good. He doesn't do me right. And it, I Let's see what else I hear.
Look, it's very tricky to distinguish and detangle what is a psychotic auditory hallucination versus what is a post-trauma auditory hallucinations. Absolutely, people get auditory hallucinations as a symptom in complex PTSD. So seeing your parents fight as a kid is especially if it's recurrent and traumatizing, can be definitely a very tricky thing. And what happens commonly is there's a bit of both. There's it's very common to have auditory hallucinations as part of a trauma process, post-trauma process, but it's also a risk factor to developing psychosis if you've had trauma. So you can have both the traumatic processes causing auditory hallucinations, but also psychotic processes causing the auditory hallucinations. And this is really where the skills and judgment of a psychiatrist is needed to detangle what is psychosis, what is trauma, and how to manage appropriately, because they do have different managements.
And the girl next door is gonna fall. And she works all day. But when she does come home, she starts screaming. She'll holler at her little boy and she'll tell him to shut up, get out of the room, leave her alone. He'll scream and he'll cry and he'll run to the house and bang things. The people across the hall feeling, I can hear them fussing. I really notice loud. Have an air conditioning, keep the door closed, and the voices don't come out too much. And they talk in Japanese, so I can understand what they're talking.
It seems that fussing upsets you.
When I was a little girl, we used to live up in Massachusetts, like in the middle, lots of times waking up in the middle of the night and hearing my daddy and mama fussing. And even after I grew up and was in high school, I'd be sleeping at night and wake up real suddenly and time to get day just hollering down, yelling real loud.
I just want to make a comment of, that was an excellent interviewing technique. He didn't even really ask a question. He just kind of made an observation. It seems that fussing upsets you. And she's just a really good patient. She's really forthcoming, engaged in the review and being open and vulnerable with the interviewer, which really helps understand what's happening. The only thing I'm not so clear on is when she's talking about the fussing of the neighbors. Is this in like an apartment complex she lives in? Or is this in her mind? The people speaking, like, it's very hard to know if there's really people in the real world fussing in Japanese, as she was saying before, or if that's part of her psychosis. So that's what you need to detangle. And what can be really helpful in these situations is actually collateral history. Talk to other people in her life, her brother, maybe her mum or her dad, if they're safe and stable, that kind of thing.
Scared me. Scared's a word to speak.
People know. Excuse me.
The door.
Just, it was like if I just burst and the man.
This is common in kids who are from like divorced families who saw their parents fight. They don't want any fight. They just want to keep the peace. They just want people to stop fighting and feel safe again. It's really hard. I just noticed she's crying at the moment. Before I noticed she giggled and I couldn't work out why she's giggling. This is currently, this makes sense why she's crying, right? But it's just important to observe people's affect, their mood, what they're doing. Are they laughing or crying? And whether it's congruent with what they're saying. So crying while talking about childhood, trauma, fights in your parents, that's totally congruent. That makes sense. It's upsetting. I get that. But if she starts giggling while talking about her parents fighting as a child, then that would be incongruent. And that can be seen in psychosis, where essentially people's affect and mood is inconsistent with what they're thinking or saying. And that's because of a psychotic process. Something to keep an eye out for.
It scares me and it makes me think bad, and I just don't like it.
How do you think you can compare now with what you haven't been your ordinary personality, what you have been in the past. Are you distant?
I don't think so, that too much. Which I hope we died her. And that's fun when I was in high school.
I guess an interesting observation here is to talk a bit about countertransference, which is a very important point for clinicians, nurses, doctors, therapists, occupational, psychological, physical therapists, and patients. So I guess what I'm wanting to do is kind of express what's happening in me watching this young woman. What I'm seeing is a young, vulnerable woman who's in pain. And my countertransference is really to want to help her, and I guess I'm embodying. I want to be protective. I want to protect her from pain. That's what I kind of unconsciously and now consciously am kind of embodying. I kind of want to be a protector of sorts. This is not something I've chosen. I haven't looked at her and said I want to be a protector. What I'm doing is I'm observing what's happening in me and noticing the process. And that's, part of being a psychiatrist is understanding what's happening in you, because that shouldn't influence what I do negatively, at least. What I should be doing is keeping a kind of, at least, as objective as possible lens, so that I'm not getting influenced by my subjective countertransference. And the reason it's important to note this, and this isn't happening here, but you can imagine the case where someone is manipulating their therapist or their doctor by using this countertransference, even if it's unconscious on their end, because that's how they've gotten their needs met in their life. So it's very important for therapists to understand that, these are the feelings that are getting evoked, and then note those feelings and then try and park them somewhere so that they don't influence your objective assessment of what's going on. I'm trying to say this and not sound cold. I don't want to say be cold and distant. It's about managing to not get over enmeshed in one patient versus another, because you're a doctor for all these patients, and at the end of the day, I'm not this girl's father. If she was my patient, I'd be her doctor. So you have to manage that. Anyway, I think hopefully I did a good enough job at explaining that. But it's an interesting thing because people don't really know about that. And when I tell my friends that it's really important to be aware of countertransference, they've never heard of the word countertransference. And transference is the other way. It's when the patient sees you as it's the attachment of the patient to you and how that's influenced by previous relationships. So if I, reminded a patient of their father and then they got angry at me because they were angry at their father, that would be worth exploring in psychotherapy. Anyway, let's stay on track. Let's keep going.
Nice tater. Yeah, it's going okay. Stupid. It's all
Are you getting sudden?
ready. Shuttle much talking about other base. I did arguments.
And do I feel that you're psychiatrically well? Stop using those.
I don't know. I don't know. Just like cloudy.
Do you need to be?
I was want to do whatever I just needed to do. I just want to keep everybody happy.
I guess before we go into the second interview, that's quite heartbreaking when a young person just wants to keep everyone happy and they're doing their best, but they're obviously suffering. Yeah, that gets to me. I think I should also note that I probably have similar temperament to her. Well, temperament might not be the right word, but I also have the want for people not to be fight. I don't like confrontation. And I've chosen a job that has so much confrontation in it. Being a psychiatry doctor has a lot of confrontation in it. You have to have a lot of difficult chats. And that brings up a lot for me that I won't go into because I don't want to share it that publicly. But it's stuff that I work on with my friends. And if needed, if I do need it, and one day I will, with therapy as well. But currently I get a lot out of just talking to my friends, and I don't think I need therapy yet because I'm a pretty happy dude. But it's a problem though, because confrontation is very important in making the world a better place. Like if you're just always compliant and passive, then people who are dominating or bullies will take advantage of that and change the world the way they want. But if you don't have your positions heard and noted, then you won't have an impact. So it's important to be a little bit confrontational in life. Guys, sorry for the interruption. If you're enjoying this kind of comment, please consider leaving this video a like and subscribing to the channel. I do heaps of videos like this, and leave a comment down below of any other footage you think I should react to. All right, let's get back into it.
Compared with last time I saw you, you're feeling somewhat different, are you?
Quite so.
In what way, if you think it?
Worst? Like I told Dr. Haynes yesterday, I was sitting down and just thinking about what things that have happened since I've been here. And on my mind, I could just almost see a curtain opening or a door opening and everything just getting real light. And I could understand, and well, I knew a lot more things that had happened and could understand them. But before they were just all confused, and I just didn't know what to think about them. And it just seemed like when the door opened, everything cleared up.
That is my favorite part of everyone's admission, is the wake up. Because often when someone's had a psychosis or a deep depression or a manic episode, they do have this experience of waking up from a dream. And, it was real, but it didn't feel real. They were somewhere else. Their connection to reality was weakened. And it's so nice when they wake up from that and the meds work.
Is there any particular thing that you feel you understand now more than you did?
Well, not any one particular thing. Just seems like, earlier, everything is just more clear. Things that I was so confused about that I didn't understand, I understand now. Can see why they happened, and why I took them personally, and I should now, because it wasn't any really a reflection on me anyway.
That's an interesting comment. A big issue in psychosis is the self. The self is, the boundaries of the self are weakened. So, people who have ideas of reference or persecutory delusions will be seeing all these things as related to themselves. They don't realize that they're actually detached. That person tying his shoe is tying his shoe because he's part of the CIA monitoring me. Like that obviously that person tying their shoe has nothing to do with that person in reality, but someone who's in psychosis will attribute abnormal valence, like importance, abnormal importance to that person tying their shoe, and so on, and they just think it's all relative to themselves. And that's not because they're grandiose and high self-esteem or anything. That's because they don't know where they start and where they end. They're leaking in. The containment of their identity and structure is leaking, and you get that in thoughts as well. They feel that their thoughts are leaking out of their heads at times. It's called thought broadcasting. They have the sense that people can read their mind because they don't think their thoughts are locked away. Sometimes there's other symptoms like écho de la pensée, which is when they hear their thoughts echoed out loud, so people can hear them. And so I just wanted to make that tangent because she's talking about how she's like realizing that those things, like, I don't really know what she's referencing here, but she was talking about the self and issues in the self, and that it wasn't her fault.
Such as? What do you think?
Well, I was feeling very rejected by my family. It's about that they just didn't care anything about me. They didn't want me around me. But I'll see now it wasn't like that at all. It was just my imagination building up things. My mother's going to nursing school. When she comes home, she's tired. And she doesn't feel like going out of her way, or maybe not out of her way, but doesn't feel like just being overly social, shall I say. And I can understand and see now her pulling on that, because after standing up 8 hours, either all day or all night, I can imagine how tired she would be. And it wasn't any personal thing against Camille. And she just didn't feel like talking, maybe, or just want to rest.
You expected something else, Harper?
Well, same as before, whenever I'd be with her, she'd have something to talk about. She'd laugh with me and everything like that. But seemed like that we just didn't have anything in common. Couldn't talk. And I'd see her. See, my family has taken in two of my cousins that are, fortunate than my family, and are giving them an education so that they can make something of themselves. And with the girls living there close in the family, well, they all had something in common, and they could talk and laugh and just generally have a good time. But I wasn't around. I didn't know much of what was going on, so I couldn't talk or join in with them. All I could do was sit there and listen, and I felt like I was being left out. But it really wasn't like that. They were trying to share their experiences with me, and I was just taking it personally. They were just leaving me out of things. I just felt like that shell has been broke.
I think another observation to make here is the term bright. She seems, it's not great quality video to be honest, but she seems brighter in this review than the previous review. And I never really understood what the word bright meant, but I use it all the time. But I think what I mean by it is someone's body language and tone of their voice and expression in their face is all just a little bit more reactive. It's a little bit more present. It's a little bit more euthymic. And I think she's got a bit more normalcy about her. She's not sitting like this, kind of closed off. She's got this kind of good posture, normal tone in her voice and normal facial expressions.
Bit brighter.
And I feel like I can talk with people better, whereas before it was a big job to be friendly, even to talk to somebody. And it's why I did not where I'd rather stay at home and go visit someone. It's a lot easier. And I think that's one of the biggest things, being alone at home and then going down the coast to, I still felt alone, even though I was with my own family.
The other day when I talked to you, you were somewhat depressed, a little tearful at times too. How do you feel in comparison to this now?
Well, I feel a lot better. And
this is a really important point. The risk. This is the problem with anxiety, depression diagnoses. It's super common. So commonly people get diagnosed with depression, anxiety. You've got to ask why. Okay, it's why is someone depressed? Why is someone anxious? If she had come in and she was tearful and she had told that story and she was said, okay, you have depression, I'm going to start you on antidepressants, and she never had the psychosis treated, you would never treat the depression because the depression is not the core issue here. She was depressed, she had depressive symptoms, but what was the cause? It was the psychosis that was making her life horrible and making her sad. So there's a hierarchy of diagnosis. The first is always organic diseases, then it's drugs and alcohol, then it's psychosis, mood, personality, and you always have to rule out the higher hierarchy diagnosis before diagnosing something below. So you're never gonna kind of treat depression if it's caused by psychosis without treating the psychosis. You'll never kind of treat a psychosis if it's caused by drugs if you don't get rid of the drugs that are causing the psychosis.
I believe the other day, I still didn't understand everything, and I was still confused. But it's been since then that this door has opened up and everything just seems to be so much clearer.
But you're not sure why the door's opened up?
No, I'm not sure why it's opened up. I just can see things a lot better than I was before. I said why people were talking to me about their problems, because really they were trying to look out for my interests. But they would talk about problems that, would be related to me, thinking that people weren't doing me right about a lot of things. See, my husband would talk to me about my mother, saying that she wasn't doing me right. And then my mother would talk to my husband saying that he wasn't doing me right. And I was just caught in the middle trying to defend both of them, because I didn't want either one of them to say anything bad about the other. And
so you were caught in the middle?
I was caught right in the middle. And then my father would get me off on the side. He'd talk about Mom. And I'm afraid to defend my mother to my daddy because he's so big and loud and everything. And I just kind of shrink when I get around him. And he's always been so loud when he's that loud at me, so it's just kind of always scared me.
Thanks for those with a good story.
Wow.
Look, I think this interview really highlighted the challenges between detangling what is psychosis versus what is a post-trauma symptom. That is a very common challenge that psychiatrists have. Do you know any ways in which you can help differentiate whether a symptom is because of trauma versus psychosis? Or do you have any experience working with people like this or having symptoms like this? Please leave your stories and comments down below. I do read them and they're just fascinating. We have a really lovely community of people watching these videos, sharing their stories and their experience. That is it for the video. Please consider leaving it a like. It really helps me, and subscribing to the channel. That also really helps me. And if you enjoy the content, that's just absolutely wonderful. And I'll see you all in the next video. And other than that, I just wish you a beautiful day full of love. All right. Bye for now.